Hi, everyone. Just to let you know, we'll get started in a minute or two. Want to get everybody a chance to get in and get settled. We're going to give it just one more minute, then we'll get started. Hi, everyone. Thanks for joining us today. All right, I think it's about time to get started. We don't want to waste any time. I'm going to go ahead and switch over to slides here. And before we get going, we're going to do a couple quick introductions. I'm joined by my colleagues Priyama and Tiffany, so they'll introduce themselves in a moment. But my name is Jen Briselli, and I'm the SVP of Experience Strategy and Service Design at Madpower.
And I'm Priyama Barua. I'm an Experience Strategy Director at Madpower.
And I'm Tiffany Mura, the Vice President of Client Experience and Strategy for the Health Vertical here at Madpower. Apologies for being off camera today. We're having some technical difficulties with my webcam, but I'll be the disembodied voice who gets us kicked off here. So before we jump into the presentation, I just want to talk a little bit about logistics. We're going to be presenting for about 20 minutes of our 30-minute session today, leaving 10 minutes at the end for questions and answers. Please type your questions directly into the question box on the GoToWebinar interface. And if we have a lot of questions coming in, we'll stay on for a few extra minutes so that these can be captured on our webinar recording. But if you run out of time and you have to leave early, please feel free to email us directly and we'll be happy to answer any of your questions. Okay, so before we jump into the meat of the presentation, I want to talk a little bit about who Madpower is. We are a design consultancy that leverages strategic design and the psychology of motivation to create innovative experiences and compelling digital solutions that are good for people and good for business. We focus on three key areas: digital solutions, experience innovation, and behavior change design. And we work across the health ecosystem in designing the future of health. Our clients range from health systems to health insurance companies to life sciences companies to governmental agencies, retail pharmacies, startups, and other non-traditional providers of health services. Every year in the springtime, we have our annual Health Experience Design Conference where we bring together the best and the brightest in the field to discuss the future of health and designing solutions for it. And this is supported by an ongoing year-round initiative called the Center for Health Experience Design that helps bring together different industry partners to collaborate together on some of the most challenging problems facing us in health today. And with that, I'm going to turn it over to Jen to get us started on the meat of today's presentation.
I was just about to make the first faux pas to start talking on mute, but I saved myself. Thank you, Tiffany. So we are excited to share with you the chronic health condition map. But before we do that, and before we get into why we think it's so valuable, why we're so excited to share it, and how you can hopefully use it in your various organizations and practices, we wanted to give you a little bit of background on what it is, where it came from. So to bring it all the way back to the origins, it's really the outcome of years and years of work with other clients, with our internal efforts to research and understand health experiences broadly. And our experience strategy practice at Madpower does this in a number of ways. It includes the types of research activities that help us gain insights and knowledge about current experiences and where there are pain points and opportunities we can plan to improve. It also helps us to understand what types of behaviors people are engaging in, what behaviors we want them to be engaging in more and others less, and which of those behaviors are things that individuals have identified as goals for themselves and designing interventions appropriately. And then also envisioning the future state. So it's one thing to understand a current state experience, but to figure how we might bring about the future ideal version and getting from point A to point B. So we've spent years doing this type of work, and everybody gets to benefit now from the synthesis and combination of these into this tool that we're excited to share. I also want to make a quick note about what form this map takes, because you'll see if you have not seen it already, it's a little bit of a hybrid between something of a traditional journey map and something we might call an ecosystem map. So for those who aren't as familiar with these types of artifacts, just to note a little bit of an introduction to what a journey map is. Journey maps are typically some type of illustration of a specific experience or scenario that unfolds over a set period of time. And it's so in that way, it's kind of constrained. It's usually going to have a beginning and an end. Not all journey maps are linear in that way, but many are. And it can include all different types of information. Usually it includes qualitative information about the emotional state, the thoughts and feelings of somebody who is having an experience. And then it can also have all different types of other layers of information. So things like other people in the experience who might influence how it goes. It might also include objects, touch points, channels via which we might communicate with that person, as well as anything behind the scenes, backstage processes, operational and data infrastructure that could influence the experience as well. And again, we could get into the semantics, but at the end of the day, most traditional journey maps are really looking at a kind of defined journey experience with one beginning and one end. And we're going to actually get away from that a little bit in this map. The other thing I wanted to introduce is this concept of an ecosystem map, which, if you are not familiar, is essentially a way of illustrating the full breadth of components in a given system or environment that might influence whatever it is we're studying. And so a lot of times an ecosystem map is really valuable to look at all of the pieces and parts in a certain experience ecosystem, but doesn't often include information about the detailed relationships between those objects or the nature of any kind of influence or exchange of value between the components in that ecosystem. They're valuable, but sometimes I kind of liken an ecosystem map in their most conventional form as a little bit like having a list of ingredients for a recipe, but not necessarily the instructions, or maybe all the parts for a parts list for an IKEA object that you don't have the instructions put together yet. So in our work, we found that we do build and deliver all different types of journey and experience maps and ecosystem maps. But in synthesizing a number of our efforts over the years, we realized that this type of map in particular ends up being a hybrid of a journey map and an ecosystem map. So this map, as you'll see momentarily, blends aspects of a traditional experience map with an ecosystem diagram, specifically so that it can support ideation and design of interventions and solutions that are designed not just with the journey in mind, but also that takes into account all of the components in the ecosystem that can be leveraged to create a good experience for somebody who, in this case, is seeking better health and managing one or many chronic health conditions. So with that, I'm going to turn it over to Priyama to talk to you a little bit more about the map itself, the journey to get to the map, and of course, we'll talk a little bit about what it's composed of and how you can use it in your practice.
Right. Thank you. So when we began the process of designing this map, we began to visualize the connections amongst the different elements of the chronic ecosystem that Jen just talked about. And what you see here is an early napkin sketch of when we first discussed it. And you'll see the mirrored connections that started to form. And we realized these connections would be different in different health situations and would be a fool's errand to map this way. Jen, next slide, please. We also used our learnings in researching and designing in the chronic health condition space to start to piece together the events in the health journey. So this is an image of a whiteboarding session where we map the journey and try to think about important needs of people living with a chronic condition. It became clear that this was not a linear journey and that events could play out differently over the years and for different people. And we wanted to make something that would represent that aspect of this. We began to layer in details and thought through what the final visual might look like to be useful for teams brainstorming in the chronic health space. And then slowly, this idea of an equilibrium state began to emerge. This is a state that someone enters once they've been diagnosed and learned about their condition, and they sort of get into a rhythm of managing it. And events outside of this would pull people out of that equilibrium. And that's the protruding shapes that you see in this image over here. Next slide, please. And from there, we iterated and we iterated. We worked with clients and colleagues to refine the content and make this map usable in a variety of contexts. On this quest to design this map, something that became clear was that using the word patient to refer to the person in this journey was no longer something we felt right doing. And Jen is going to talk a little bit about why.
As you can probably imagine, if you are a person who does manage a chronic condition, thinking of yourself as a patient is a pretty narrowing way to consider yourself. And we know from all different types of research in the world, ours and others, that using terms like user or patient or even consumer can strain the sense of identity that somebody has, but not only in terms of how they think of themselves, but in how we design for them. So in order not to limit how we think about the people that we're trying to serve through our design, we decided to use the term health seeker. And so what we mean by this term is someone who wants to be healthy and who may be aware of their own motivations to improve their health. Health seeking is a natural pursuit of personal well-being, which may be defined very differently for every individual and allows for a lot of flexibility and diversity in terms of how someone might define that success. It also removes some of the value judgment implied in what is considered healthy and what isn't, and the agency that people do and don't have in becoming healthy as their own individual journey allows. You might also ask, what if someone isn't a health seeker? A health-seeking journey exists over a lifetime, and one's encounters, experiences, and the pursuit of well-being might change over time as well. So this is not about placing a judgment on those who we may perceive not to be seeking actively greater state of health. It's much more about understanding how we can depict that continual process of health-seeking over time, with no judgments and also no final state. The point is that it really is about achieving an equilibrium that we can maintain as healthfully and easily as possible that empowers people to live the lives that they want to live. Just to also give you a little bit of an introduction to some of the details of the map, I'm going to walk you through some of the key components, and then Priyama is going to talk to us about how you can actually use the map. So the first is to look at the outer ring. As Priyama mentioned earlier, we envision this experience to be one of seeking and maintaining equilibrium. But of course, sometimes things will knock us out of equilibrium, and that's what some of those little bubbles that stick out are meant to represent. You'll be able to see this a little closer as you play with it yourselves, but the outer ring consists of different events that we consider part of a normal, healthy equilibrium managing a chronic condition, as well as typical events that might be the type of thing that does knock someone out of equilibrium. So events that are part of that equilibrium are things like regular self-maintenance, regular visits to healthcare providers, regular maintenance testing, and so forth, as opposed to the appearance of, say, a new or concerning symptom or some type of an emergency or acute event that might occur. Those are going to be the types of activities that might happen, even though they are not ideal, that we can learn to plan and design solutions for. You'll also see in the center of the map the components of the ecosystem that influence that experience. And so in this case, we found it was valuable to think about 4 different categories of components that live and influence someone's management of their own health and their chronic conditions. So that includes social types of components. These are the people and organizations, communities, and other social networks that somebody is part of or that are available to somebody. Another is the environment. So this is the physical environment that somebody finds themselves in. And this can be both something that influences health. For example, someone with asthma might have flare-ups at different times of year or based on environmental and weather changes. But this can also be a source of data and information that can be used to influence and inform people about how to preempt or avoid certain types of things. If you know that a drop in the barometric pressure is something that causes migraine, for example, we can help folks learn how to preempt those based on data we have about the environment that is available to everybody. Another category here is the self. So these are the psychological and physical influences, as well as things that the individual health seeker is able to engage in and take on as their own choices. And then finally, physical and digital. So these are objects or interfaces that a health seeker may come into contact with or rely on as they manage their health conditions. And so Priyama is going to talk a little bit now about the map. We've given you a little of the backstory and we've kind of introduced you to the main components, but really the exciting bit is how you can use this map in your own work, hopefully to envision better futures for folks that are managing health and chronic conditions.
So once you do get the map into your hands, and I'll talk about how you can do that, you will see instructions on how to use it, but I want to quickly walk you through them right now as well. So firstly, you would start with a single health event that you want to focus on, and this is your key moment. Brainstorm a how might we statement that could help support in that key moment. So for those who are not familiar with how might we, that's your positioning of what problem you are trying to solve. And then thirdly, identify other events that may influence or impact that key moment and that event. Um, and fourthly, start identifying entities within the health ecosystem that influence or impact that event. So the four categories that Jen talked about, we have them as empty spaces on the map that you can brainstorm and add in stickies and add in thoughts on what those ecosystem elements would be. And then once you've gotten the lay of the land, you can brainstorm solutions that relate to that key moment and that how might be that problem that you started solving. It's easier to do that once you get an idea of what the other influencing health events and the ecosystem entities that you have identified. And I'll walk you through an example in a second. And once you're done doing that, you can move on to other health events as relevant to your project. So it's not something that you just use once. You can use it over and over again as your project needs evolve. So next slide, please. So here you'll see an example that we've illustrated for you. You can see here that the how might be that we're working on is making the health data more accessible. I apologize if you won't be able to read the text, but I'll try to walk you through it as best as I can. So in this, the key moment is an urgent care or an ER visit. So if someone has had an exacerbation of their acute condition, chronic condition, and they've ended up in the ER. So that is the key moment you're solving for. And a how might be statement here is that making health data accessible to that person in that moment. We know from research and from experiencing healthcare events ourselves that that is a huge pain point for a lot of people because a lot of electronic systems don't talk to each other. And people in the ER rely on patients and their families to fill in the details of what medication they're on, what their blood type is, etc. So that being the key event and the how might be statement, what if you were to identify associated events? And in this case, this is just an illustrative example. We've identified a regular healthcare provider visit. So whether that is with the PCP or a specialist, and any test they might send the patient for, X-rays, blood tests, etc. So the regular maintenance testing that needs to be done. You might also identify events such as meeting a non-regular healthcare provider. So if you decide to get a second opinion or go to a different doctor that the regular healthcare provider has referred to, and any non-regular testing that is done. Other associated events could be getting prescriptions refilled on time, so that could give an idea of whether this person is taking their medication on time. So that is the lay of the land in terms of the journey. And then we move on to the ecosystem. What are the social aspects of this ecosystem? So it could be the lab staff, it could be the ER staff, it could be the first responders, the pharmacy staff, because we talked about refilling medication, providers that the patient meets, family, friends, and other support system. And in the environmental, the actual place that they are in, it could be the ER, it could be the doctor's office, the ambulance itself, and at their the people's homes. From the point of view of self, it could be monitoring their own symptoms and following doctor's advice, keeping a record of treatment plans. And from a physical and digital touch point aspect, it could be medication packaging, it could be health forms that they're filling out at the doctor's office or at the ER. It could be the EMR data that is available to the patient and education material given by the doctor. So this is just an example of some of the things that would go in here. And then when you start thinking about the solutions, you can think about things like, what if to prepare someone for an ER visit, a doctor provided a printout and or maybe even emailed a health summary after every visit to the patient? What if they give a free medical bracelet for all health seekers that may end up in the ER due to their chronic condition? Another solution here could be, what if at the doctor's office you had an Apple Health training so that first responders can access Healthseeker information when they are in the ER. So this is how you would go about doing that. And once you look at this, if you think of ideas that pertains to this solution, feel free to put them in the chat box, in the question box, and we can chat about them. But that is just an illustrative example of how you would use this map. So next slide, please. So we've made two versions of the map. It's really the same thing, but we've modified it for remote use. It can be downloaded at the link that you will be sent after this webinar, and you were probably sent before as well, and can be printed out and used in workshop settings if you're co-located. But if you're not, there is also a mural template that you can use to create your own map from, and you can collaborate remotely using the mural platform. So examples that we've used this project, so where we've used this map in projects. We've on the left, you see an example of using it with a life sciences company to think through new business models. And these could be business models that they invest in as a focus towards wellness rather than sickness. We also used it with a pharmaceutical company to develop an AI-driven chronic condition management system that would meet patients where they are. So thinking through all the elements of the patient's ecosystem as well as the journey elements that they go through. And these are just some quick examples, and we'd love to hear about how you envision using it in your own work. So next slide, please. When the slide deck does go out to you, you can have the link here. And again, the link will be available in the email that goes out for you. And we'd love any questions that you might have. Tiffany's going to help us with finding some of the great questions that I hope are already there in the question box.
Yes, so thank you, Priyama. I'd like to start with a question here on whether or not you found that there are certain moments that matter that might be common across chronic conditions such as diabetes, hypertension, CHF.
Oh, that's a good question. I guess I would probably I would zero in on the phrase "the moments that matter." I think at its core, and I think maybe Priyama, keep me honest on this, but I would probably respond to that by saying this map represents those. It's a little bit a result of finding some of those common moments that matter, or hero moments, or key opportunities, or how we might want to think about them. Seeing some of those commonalities emerge over a number of different types of engagements and challenges over the years, and through exposure to all the different types of scenarios that a lot of health seekers find them in. So I would probably answer that by saying the most common moments that matter are the types of things that are included in this map that are represented as either key moments in an equilibrium that we hope people can maintain, things like, again, regular health visits and so forth, but also some of those most common types of things that knock somebody out of equilibrium. I think I mentioned earlier the appearance of a new symptom, or symptoms growing more severe, things that involve an acute episode of some kind. There's a lot of very good food for thought there, because if somebody does have a flare-up or an acute episode, which can really be a lot of different things, right? Thinking of any condition, there are many where if you ask yourself, what would the scenario look like if somebody had an acute flare-up or something was no longer being well controlled? What happens there is a number of different types of fallout if it's not well managed or not mitigated. So something that might have been minor and insignificant could quickly become very significant. And on top of the implications for someone's own health, it can also have fallout for their financial situation, depending on billing and insurance and payer situation, as well as it can influence their daily life going forward. So finding opportunities to both preempt, ideally, if not preempt, mitigate, and then once mitigate, also help recover. Those are the types of moments that matter, and they're intentionally generic in this map to allow for the specifics of a condition to kind of play out in that work. But long-winded way of saying, I think the map itself represents those moments that matter, and things like new symptoms and flare-ups and life events are really big ones for a lot of folks. I don't know if Priyama or Tiffany, you guys have anything you want to add?
I think a lot of same of what you said, Jen. I like to think of it as in three chunks. One, which are the key moments where someone can interject. One is the part of the map where when Jen talked about someone doing the initial diagnosis, information seeking, and education, so that being one chunk. The second is the equilibrium state. So getting into that equilibrium state is not easy either. So setting a rhythm of taking care of oneself and staying within it. And the third chunk I see is all the different events that take someone out of that equilibrium state that is extremely hard for people who are managing.
I think we may have lost Priyama temporarily there. Jen, did you have anything you wanted to add to that, or shall I go on to the next one?
No, I think that was good. Hopefully Priyama comes back. I also can't tell if that was, I wasn't sure if it was mine or hers, so good to know it was me as well. We can go to the next one, and if
Okay,
Priyama
excellent.
can get audio back, we'll follow up.
So one of the other questions along those lines regarding the key moments is, do you have any advice on how to hone in on those key moments that you want to focus on? And is there any aspect of considering who the patient is from a persona perspective when you hone in on those?
Short answer is yes. I think the extent to which you can understand the details of who you're designing for, always helpful. So that can take a lot of forms. That can take the form of research that gives you some personas or other types of behavioral archetype knowledge about the different folks. It can also take the form of having done work, say in a framework like jobs to be done modeling. So it's not always tied to an individual. It could be tied to the types of things they're trying to achieve. There's a lot of room to bring that type of knowledge into this work. So I would look at it as all the research that you have about who you're designing for should be the table stakes type of foundational bricks you bring into a workshop or a session where you might engage with this map. So short answer to that is yes, bringing and folding all that knowledge in is just going to enrich what you're designing for, but it's not a requirement to have things like separate personas that you're thinking about. Sometimes just approaching this map as a tool to be able to ask, are we thinking about everything? Are we considering everything for a health seeker? Are there key things that we know are going to be important that we haven't considered and we need to make sure we're accounting for, even if we haven't done the work to differentiate between different segments of an audience and that sort of thing. I see Priyama, you look like you're back. Is the audio working?
I can hear you. I'm so sorry about that.
Excellent.
Do you want a chance to weigh in on this one as well?
I didn't hear the question, sorry.
Oh, no worries. I'll cue off that though, and perhaps you can weigh in on this one as well, is regarding prioritizing the moments that need to be addressed. How do you effectively prioritize them? Where should you be focusing your energy?
I can take that. It depends on the project, honestly. Depends on the company and where you are trying to solve. And it could be that you determine that 5 events are important that you want to solve for. And depending on the use case, so it could be that you're trying to enhance an existing product or service, could be you're trying to think about a completely new product or service that your company can offer. So depending on that, you can maybe pick 5 key events and then work through them one by one. So it doesn't have to be that you prioritize one and stick with it. You can use multiple, and depending on how the solutions come out, you can then decide to keep some brainstorming sessions and discard some of the others.
Excellent. Now shifting gears to HCPs, there's a couple questions on using these with HCPs. Have you been able to utilize this mapping with healthcare professionals as well? And are they helpful and effective in positioning for a provider who needs to positively position a solution or a product for a patient?
That's a really interesting question. I mean, we haven't done anything of exactly that sort, I'll be honest. I would love to. I hope to see others using it in that way very soon. We have worked with this map with people in a lot of different roles, including providers, but taking it to the level of what is mentioned in that question that's a fantastic application of this. I think that would be great because there's a lot you can do here that goes beyond brainstorming new ideas and instead co-creating with the people who are going to be responsible for delivering experiences, for example, providers, and delivering health experiences to patients. I think this could be a really powerful tool. So while we have worked with providers and with the map, I think the exact application in that question sounds like fascinating, and I would love to hear if somebody's able to go ahead and use it in that way, how that goes.
Yeah,
Excellent.
and also because you providers see patients in such a snapshot in just in this whole map. They're just one or two bubbles where it's the provider is the most important person. And that's the only picture they see. They don't see the rest of the person and their life and their ecosystem. And I think that in general, there's been a lot of interest from providers and those that teach upcoming doctors and teach in medical schools to be more aware and cognizant of this wider ecosystem and journey of chronic health patients.
Excellent. I've got another question. I know we're right at time, but I think this one's really, really interesting. And if we've got one more minute, I'd love to address this one. What are some of the ways this map could be misused? Are there any potential pitfalls we should watch out for?
I just love that someone asked that question. I
Yeah.
thank you for asking that. I think that is, you know, Hippocratic Oath level responsibility to the people we design for and that we serve. So thank you, whoever you are, for asking that. My first thought goes to using this map as a stand-in for doing the hard work and due diligence to truly understand the experiences people have. So yes, this provides a little bit of a shortcut to stand on the shoulders of work that has been done over years to understand these patterns that emerge, but this is not a substitute for research with the individual folks that are going to be impacted by any work that comes out of this. And that may take a lot of forms, you know, but ultimately, this is not a substitute for good, humane, empathy-driven design work, but it's hopefully an accelerator and gets the process moving faster and more farther along than it would without it. So I think oversimplification and using this as a substitute for parts of processes that should happen would be the main risk I can think of, first of all. I'm curious what you say, Priyama.
I was thinking about, because we do so much behavior-based design, we need to be very aware of designing for behavior that is beneficial to health seekers and their families and doctors and the relationship to the doctor. It is so easy to find ourselves in a place where we are designing something that is manipulative, for lack of a better term. It is very easy to find yourself in that place. An example I can give you is keeping people out of the ER and, not wanting to, insurance companies not wanting to spend money there. But if someone needs to go to the ER, they need to go to the ER. And, it's easy to think about this as way, oh, how can I use this to design for behaviors that benefit the business, but not necessarily the health seeker. I think that's a pitfall to avoid.
Definitely. Those are great answers. We have a couple more if we want to stay on till 12:35, and then if we get any stragglers, we can always answer those afterwards. The question came up with how have we seen teams use this to make decisions?
A little bit like the example that I gave you, and the two projects that I talked about. So in one example with the life sciences company, it was clear that they wanted to focus on the patient's well-being before they were even sick and look at the whole person instead of looking at the person that is unwell or has a chronic condition. And by understanding the chronic journey, they were able to firstly deeply empathize with the personas we used for this journey. So it can be used alongside a persona. And secondly, help them see a picture outside of medication. So looking at things like when someone travels, what does that look like? What does their home life look like? What does a visit to the ER mean to a person? What does it mean when they try a new intervention? So help them sort of zoom out and look at the bigger picture to come up with a new business model that they wanted to invest in. Secondly, we also use it in the example that I gave with a company to develop an AI-driven condition management system. And that helped piece together and inform what what elements of the ecosystem should be utilized to make recommendations and give direction to health seekers at different points. So in that sense, it really informed or could inform the work of the people that would be building the algorithms and building the smart systems and building the artificial intelligence that drives the system.
And I'll just add really quick, I think both true for this map in its form that it takes now, as well as a lot of other types of experience maps. One of the biggest values is with guiding and informing the decision making around where to invest. When you have done the work to look at the full holistic journey, as Priyama's talked about, you can also see what components are going to be critical to support at many places in that journey, and which other components might be very critical but only at a single point in the journey. And that can help with decisions around whether to develop or build a capability that might not exist today that's important to invest in, so you can serve many parts of that journey, versus something that might be only important for one moment in the journey, and perhaps that's then a lower priority for investment, or is more about partnering with somebody or finding a service out of the box, as a third party that can do it. So some of the types of conversations you'll have around feasibility and investment to deliver new experiences can be informed with a map like this, to see how far across a journey something's going to have an impact.
Excellent. And I did have one audience member say that they're ahead of a product for a healthcare provider, and they will definitely be using the map this way. So thank you. So
great.
That's exciting to hear.
Keep us in the loop. Let us know how you use it, because we're so excited to get this out in the world and see how folks are able to make use of it. Sometimes I find, I was talking to these two about it earlier, sometimes webinars like this are about knowledge sharing, but today's is more about sharing a tool with you all. And I can't wait to see this tool in so many people's hands. So let us know how you use it. We'd love to hear.
Excellent. Well, thank you to everybody who asked those fantastic questions, and for everybody's time in joining us today. Any closing remarks, Jen or Priyama?
None here, other than I truly appreciate the nature of some of those questions. I think that I am confident and excited to see what you all are able to do with this map, and hopefully some of us, we get to collaborate at some point in the future. Thanks for joining us today.
Yeah, thank you. And if you think of any follow-up questions, please feel free to reach out to us. We're always happy to answer them.
Thanks all. Have a good day.
Thanks.
Bye-bye.
Bye.
Bye.